You know that feeling. You get your lab report back, and it looks like a secret code, right? Just a bunch of acronyms and numbers. It can be super confusing. Well, today, we're going to crack that code. We're going to demystify your kidney function tests together.
So, you're scanning that report and you see it, BUN and creatinine, next to some numbers, and you're probably thinking, what on earth do those even mean? Look, if you've ever felt a little lost trying to figure that out, you are absolutely in the right place. We are about to make sense of all of it. Okay, so let's think about this like a detective story. Seriously, your lab report, that's our case file, and it is packed with clues. And for the next few minutes, we're going to be the detectives, you and I, solving the mystery of what these numbers are really telling us about your health.
And you know, every good mystery has to start at the scene of the crime. For us, that scene is your kidneys. I mean, these organs are just amazing. They're like the body's master filtration plant, and they are working around the clock 24/7 just to keep everything in balance.
So what exactly is this filtration plant doing all day? Let's take a quick peek under the hood and really get a handle on the super important job your kidneys are doing day in and day out. It really boils down to 4 main jobs. First, the big one, filtration. They filter all of your blood. Then, reabsorption. They're smart enough to pull back all the good stuff your body needs, like water and electrolytes. After that is secretion, where they actively push any extra waste into the mix. And finally, excretion. That's when they get rid of the final product, urine. And all that waste goes right out of your body. It's just a brilliant, nonstop cycle.
All right, so we get how the whole operation works. Now it's time to look at our main clues. In the world of kidney health, the 2 biggest clues we're going to find in your blood are, you guessed it, BUN and creatinine.
So let's start with BUN. That stands for blood urea nitrogen. It's pretty straightforward, actually. When you eat protein, think chicken, beans, steak, your body breaks it down and, as part of that process, creates a waste product called urea. Now, if your kidneys are healthy, they just filter this stuff right out. So the BUN number is basically just telling you how much of this waste is hanging out in your blood.
Okay, on to our second clue, creatinine. Now, this is a totally different kind of waste product. This stuff comes from just living. It's from the normal, everyday wear and tear on your muscles. And just like with BUN, it's the kidney's job to grab it and get it out of your bloodstream. Okay, so let's break this down. BUN comes from the protein you eat. Creatinine comes from your muscles. 2 different sources. But here's the key thing they have in common, and this is super important. They are both waste products that will start to pile up in your blood if that filtration plant, your kidneys, isn't working at 100%.
So, that brings us to the million-dollar question, right? What does it actually mean when these numbers start to creep up? What is that lab report trying to tell you?
Well, the basic formula here is actually pretty simple, but it's really powerful. If you see both your BUN times your creatinine levels going up at the same time, that's a big indicator that your kidney's ability to filter is slowing down. Honestly, that's the #1 signal we're looking for. But hold on. Any good detective knows you have to dig a little deeper. We don't just want to know what's happening, we need to figure out why. And that's where our next clue comes into play, the BUN to creatinine ratio. By looking at how these 2 numbers relate to each other, we can get way more specific. And this ratio, this is where things get really interesting. See, if your BUN number is high compared to your creatinine, it often points to a problem that's happening before the blood even gets to the kidney. We call this a pre-renal issue. Think of things like dehydration or maybe just not enough blood flow. It could mean your kidneys themselves are perfectly fine, they just aren't getting enough water to do their job properly. Huge difference. Okay, so our case is building. The blood test gives us one side of the story, but to really confirm our suspicions, we need more evidence. We need to see what's actually coming out of that filtration plant. Yep, we need to take a look at the urine. Think of a urinalysis as getting an eyewitness account from the scene. It's that critical piece of corroborating evidence. It shows us exactly what's happening downstream and helps us paint a much clearer picture of what's going on with kidney health. And wow, the clues we can find here are just invaluable. You find white blood cells, that could be a sign of an infection, like a UTI. What about protein? That's a big one. Finding protein in the urine can point to actual damage to the kidney's filter, because those protein molecules are supposed to be too big to sneak through. And if you see glucose, well, that could be a red flag for uncontrolled diabetes, which is one of the biggest causes of kidney problems. Okay, so we've gathered all our clues. We've analyzed the evidence from the blood and the urine. Now it's time for the verdict. What does all of this mean for you, and what's the action plan from here? Here are 3 really practical things to keep in mind for your next doctor's visit. Number 1, don't get hung up on a single result. One test is just a snapshot in time. It's the trend over several tests that tells the real story. Number 2, listen to your body. Things like feeling super tired, weak, or even having itchy skin can be important clues. And number 3, this is crucial. Make sure your doctor knows about every single thing you're taking. Prescriptions, over-the-counter stuff, supplements, because a lot of them can affect your kidneys.
Look, if you remember only one thing from all this, please let it be this. A single result is not the whole story. Don't panic over one number being a little high. It is the trend, the direction those numbers are moving over time, that is so much more significant. That's what truly paints the clearest picture.
So, the next time that lab report lands in your hands, you're not going to be in the dark anymore. You are now the detective. You know the clues to look for, you know the right questions to ask, and you know how to start making sense of it all. Mystery solved.
You know, deep inside your body, there are these 2 silent workers on the job 24/7, your kidneys. Today, we're going to journey into the microscopic world to meet the real powerhouse that makes it all happen, the nephron. Let's see how this incredible little machine actually works. Just look at that number, 1 million. That's roughly how many of these tiny, super complex filtering units are packed into each of your kidneys. So that's 2 million in total, all working nonstop to keep your body perfectly balanced. I mean, the scale of this operation is just mind-blowing. And yeah, that brings us to the big question, right? How in the world does this microscopic machine, the nephron, pull off its critical mission? How does it take in your blood, sift through absolutely everything, and decide what to keep and what to get rid of? Well, let's dive in. Okay, so the whole process can really be broken down into a pretty clear 4-step mission. This is the fundamental pathway that turns blood into urine. You can almost think of it as a super sophisticated purification assembly line. So here they are, our 4 key stages. First up, you have filtration. That's the initial separation. Next is reabsorption, which is all about taking back the good stuff. Then there's secretion, kind of like a final cleaning step. And last, excretion, which is, getting the waste out of the body. Let's walk through them one by one. All right, let's start at that first checkpoint. Blood comes rushing into something called the glomerulus. It's basically a tight little bundle of tiny blood vessels. This is where the first heavy-duty separation begins. It's a really crucial first step, but as you're about to see, it's not very picky. The process here is called ultrafiltration. Imagine you're spraying a high-pressure hose through a kitchen strainer. That pressure forces all the small things like water, salt, sugar, and tiny bits of waste right out of the blood. Now, you might be thinking, well, that sounds kind of inefficient, but it's actually a brilliant safety feature. By pushing out all the small molecules first, the kidney makes sure that no new or unexpected toxins can sneak past this first checkpoint. And this table shows you exactly what gets through and what's left behind. See how all the small stuff, water, glucose, waste, gets pushed out into what we call the filtrate? But the big, important things like proteins and blood cells, they're just too large to pass through, so they stay in the blood. The key takeaway here is that this first filter removes both good and bad small molecules. So because that first filtration step basically threw out a ton of valuable stuff, this next phase is all about quality control. This is what I like to call the Great Kidney Exchange, where the body carefully sorts through that filtrate and decides what to keep and what to toss out for good. So the first part of this exchange is reabsorption. And the key word here is re, as in to do something again. The body is literally absorbing these essential things for a second time, pulling them out of that filtrate and putting them back into the blood where they belong. This is the big reclamation step. And what is it taking back? All the essentials. I mean, the body works incredibly hard to pull back most of the water, all of the glucose and amino acids, and just the right amount of electrolytes. It's making sure we don't accidentally throw away the crucial stuff we need to function. Now, the other side of this exchange is secretion. Think of this as the final trash tossing step. Here, the body actively grabs extra waste products that might have been missed before and moves them from the blood directly into the filtrate. It's how it fine-tunes the whole cleaning process. So what kind of things are we actively dumping? Well, think of stuff like excess potassium or hydrogen ions to help keep your body's pH in balance, and of course, other toxins or drug byproducts. Secretion is how the body gets rid of that last bit of junk with real precision. Okay, so it is absolutely crucial to get this difference. Reabsorption moves good things from the filtrate back to the blood. Its purpose is to keep the essentials. Secretion moves waste from the blood into the filtrate. Its purpose is to dump the junk. They are total opposites, but they work together in perfect harmony. So this is all great when it's working perfectly, but what happens when this complex system starts to break down? Well, by understanding how it's supposed to work, we can actually diagnose problems just by looking at the symptoms. The process itself gives us all the clues we need. For example, let's say a doctor finds protein in your urine. Now, what does that tell us? Remember that very first filtration step? Big molecules like protein are not supposed to get through that initial filter. So if protein is leaking out, it tells us exactly where the problem is. The filter itself, glomerulus, is probably damaged, and it's letting things pass through that it shouldn't. It's a direct clue pointing right to the source of the issue. Okay, let's look at another clue. What if someone's blood tests come back and their electrolyte levels are all out of whack? You know, the essential minerals that manage everything from your nerves to your hydration. Well, this symptom points to a completely different part of the nephron. If the body can't keep its chemical balance, it means the reabsorption and secretion steps aren't working right. And that fine-tuning happens in those long, winding pathways called the tubules. So the problem isn't the main filter, it's the sorting and exchange system further down the line. I know that was a lot to take in, so let's lock in the most important concepts with 2 super simple rules. If you remember anything from this, remember these 2 things. First one, when you hear reabsorption, just think, keep it. The body is taking back everything it needs to keep. It's that simple. And the second one, when you hear secretion, think, dump it. The body is actively getting rid of what it needs to dump. Keep it versus dump it. That is the heart of the kidney's great exchange. So, there you have it, the incredible journey that happens inside a single nephron. It all starts with a powerful, kind of messy filtration, and it's followed by this careful process of reclaiming the good stuff and refining the waste, all to create urine. It really is a beautiful and efficient system. And just think about this for a second. Your entire blood supply gets filtered like this about 60 times every single day. This microscopic journey is happening constantly, and you never even have to think about it. Which really leaves us with one final thought. Are you giving these tireless little machines the support they need to keep doing their amazing job?
Have you ever gotten a weird pain and just thought, okay, what is my body trying to tell me right now? Well, today we're going to decode some of those signals. We're diving into 2 super common but also potentially really serious issues. What happens when your body's plumbing gets blocked up, and what happens when it gets, well, invaded. Let's get right into it.
You know that feeling? That sudden, sharp pain that shows up out of nowhere in your side or your back? You might brush it off. Think maybe you just slept wrong. But what if it's more than that? What if it's actually a critical alarm bell coming from deep inside your body? We're about to find out exactly what it could mean.
All right, first up, let's tackle the blockage problem. We're going to investigate what happens when things get physically stopped up. Think of it like a major plumbing issue, but happening inside of you.
Now, the fancy clinical term for this is obstructive uropathy, but that just sounds complicated. A much better way to think about it is a traffic jam in your urinary tract. It's that simple. Just like a kink in a garden hose, something is physically stopping the flow, and that causes everything behind it to back up.
And when that backup happens, it sets off this really dangerous domino effect. First, the blockage causes urine to pile up, which creates a ton of back pressure. This pressure then forces the pipes, the urinary tract, to swell up and expand. That's a condition called hydronephrosis. The name kind of gives it away. Hydro for water, nephrosis for a kidney issue. And here's the most important takeaway. If you don't fix it, that pressure can end up doing permanent damage to your kidneys.
So what's actually causing these traffic jams? And maybe more importantly for you, how can you spot the warning signs before things get serious?
Well, the causes really fall into 2 main camps. First, you've got intrinsic causes. Think of these as problems inside the tract itself. The most common culprit here? You guessed it, kidney stones. But it could also be things like blood clots or tumors. Then you have extrinsic causes, which is pressure coming from the outside. Things like an enlarged prostate or even a pregnancy can physically squeeze the urinary tract from the outside in.
Okay, now this is where you really need to listen to your body, because it sends out some very specific signals. Flank pain, that's pain in your side just below your ribs, is a classic.
But the big one to watch for is something called renal colic. This isn't just a pain that stays put, it's a severe, sharp pain that actually travels, usually from your side down into your groin. Other major red flags? Blood in your urine for sure. But also, and this is a big one, a steady decrease in how much you're actually peeing. That last one is a sign that things could be getting pretty serious.
All right, so we've covered the plumbing problem. But here's the thing about that stagnant, backed-up urine. It's basically the perfect breeding ground for bacteria. So a physical blockage can very quickly turn into a full-blown biological invasion.
And this brings us to the other side of the coin. Sometimes, that pain and discomfort you're feeling isn't from a physical traffic jam at all. Sometimes, it's from microscopic invaders that have set up shop where they don't belong.
Yup, we are talking about urinary tract infections, better known as UTIs. This is what happens when bacteria manage to get into the urinary system. And the most common trespasser by far, E. coli, which, usually lives harmlessly in our gut.
So who needs to be most on guard for these? Well, UTIs are way more common in women, and there's a simple anatomical reason for that. A shorter urethra just gives bacteria an easier, shorter path to travel. Other major risk factors include being an older adult, being pregnant, or having to use a medical catheter.
And just like with obstructions, the symptoms you feel from an infection can tell you a whole lot about where exactly the problem is and, more importantly, how serious it's become.
Let's break it down by location, because it matters. A lower UTI, that's an infection that's just in the bladder, is going to give you those classic localized symptoms. Pain when you pee, feeling like you have to go all the time. But if that infection travels up into the kidneys, it becomes an upper UTI, or pyelonephritis. And that is a whole different ballgame. It's way more severe and it brings on systemic symptoms, like a fever, chills, and that familiar flank pain.
Okay, I need everyone to listen up for this one, because this is a hugely important piece of information that can, quite literally, save a life. In older adults, all those classic UTI symptoms might be completely missing. Their immune response can be different, so instead of pain or burning, a sudden new onset of confusion might be the only sign that they have a serious infection. It's a critical connection to be aware of.
So we've identified the problems, both the blockages and the invasions. Now let's switch gears and talk about solutions, what to do about them, and even better, how to keep them from happening in the first place.
When it comes to a UTI, the path to getting better is pretty straightforward. It all starts with getting a proper diagnosis from a urine sample. From there, it's usually a course of antibiotics. And I know you've heard this a million times, but it is absolutely essential to finish the entire prescription, even if you feel better after a couple of days. You gotta wipe out the infection completely. And at the same time, drinking more fluids helps to literally flush the bad bacteria out of your system.
You know what's even better than treating a UTI? Not getting one to begin with, right? And prevention often comes down to a few simple, smart habits. Wiping from front to back, that's a big one for keeping bacteria away from the urethra. Urinating after sexual activity can also help clear the pathway. Little things like this, plus just staying well hydrated, are proven ways to seriously lower your risk.
Phew, we have covered a lot of ground today. So before we wrap up, let's just boil it all down to the 3 most critical, must-know signals. If you see these signs, you'll know exactly what you should be thinking about.
Okay, signal number 1. If you ever feel that severe, sharp pain that seems to travel, that radiates from your side down towards your groin, your first thought should be, this could be a kidney stone causing a blockage.
Signal number 2. And seriously, if you remember one thing from this entire explainer, please make it this. If you see sudden, unexplained confusion in an older adult, don't just dismiss it as a part of aging. Your very first thought should be, this might be a UTI. And finally, signal number 3. If you notice that you're just not peeing as much as you normally do, that your urine output is steadily decreasing over time, that is a massive red flag. It points to a worsening obstruction that really needs immediate medical attention.
All of these things, from that radiating pain to sudden confusion to just not peeing as much, they aren't random. They're very specific signals. It's your body's way of telling you that something is wrong. Knowing how to read them is the first, most powerful step you can take to protect your health. So the real question is, are you listening?
All right, let's jump right into this. Imagine one of your body's most vital systems just suddenly stops working. That, in a nutshell, is acute kidney injury, or AKI. It's a sudden, pretty serious shutdown, and today we're going to play detective and unravel the 3-part mystery behind what actually causes it.
So what are we really talking about here? Well, AKI is basically a rapid-fire decline in your kidney's ability to filter stuff out. And when they can't do their job, all these nasty waste products start to build up, and the body's super delicate balance of fluids and electrolytes, it just gets thrown completely out of whack.
So here's our game plan for cracking this case. First, we'll nail down the basics. Then, we're going to investigate our three main culprits: a flow problem, a filter problem, and an exit problem. After that, we'll learn how to spot the clues, the red flags. And finally, we'll open up the playbook on how to manage it.
But the big question is, what's actually causing this shutdown? See, the key to understanding and, more importantly, treating AKI is knowing exactly where the problem is coming from. Is it happening before the kidney, inside the kidney, or after the kidney?
Okay, first up, pre-renal AKI. And the clue is right there in the name. Pre means before. So this tells us that the problem isn't actually with the kidney itself, but with the blood flow that's trying to get to it.
Now this is the crucial part. The kidneys themselves are totally fine. They're healthy. Think of the kidney as a busy factory. In pre-renal AKI, the factory is in perfect working order, but the delivery trucks bringing the raw materials, in this case blood, they've just stopped showing up. And without that supply, the whole operation just grinds to a halt.
So what stops those delivery trucks? Well, it could be something like severe dehydration, maybe major blood loss, a sudden sharp drop in blood pressure, or even shock from a really bad infection. Basically anything that reduces perfusion, which is just the fancy medical term for blood flow to the kidneys, can set this whole thing off.
All right, let's move on to our second suspect, intrinsic AKI. Now with this one, the problem is no longer about blood flow to the kidney. Now the damage is happening directly inside the kidney tissue.
The issue here is direct damage to the nephrons. Those are the tiny little filtering units inside the kidney. So, if we go back to our factory analogy, the delivery trucks with raw materials are arriving just fine, but the machinery inside the factory is busted. The filters are damaged and they just can't do their job anymore.
So what breaks the machinery? Well, it can be toxins like certain medications or the contrast dye they use in medical scans. It could also happen if that pre-renal state, that lack of blood flow, goes on for way too long. That's called prolonged ischemia, and it basically starves the kidney cells of oxygen, causing direct damage. We call that condition acute tubular necrosis, or ATN for short.
And that leads us to our final culprit, post-renal AKI. You guessed it, post means after. So this problem isn't about the flow coming in or the filtering happening inside. It's all about what happens after the kidney has already done its job and made urine.
Yep, this is purely an exit problem. The kidneys have done their work. They've filtered the blood, they've made the urine, but there's a roadblock preventing it from leaving the body. In our factory analogy, all the products are made and ready to ship, but the exit ramp is completely blocked. This causes a massive pileup that backs up into the factory and starts damaging everything.
So what could cause a blockage like that? The usual suspects are things like kidney stones, an enlarged prostate in men, tumors that are pressing on the urinary tract, or even blood clots. The key here is you've got to clear that obstruction, and fast, to prevent any permanent damage.
Okay, let's do a quick memory lock here. Pre-renal is a perfusion problem, not enough blood getting to the kidneys. Intrinsic is direct kidney damage, a problem inside the kidneys. And post-renal is an obstruction, a blockage after the kidneys. It's a really simple way to keep the three types straight in your head.
So now that we know the causes, how do we actually spot the problem? Well, it turns out that regardless of the type, pre, intrinsic, or post, the body sends out some pretty universal distress signals when the kidneys are in trouble.
And here's the tricky part. These symptoms can be super general. A patient might feel incredibly tired, nauseous, maybe a little confused. And it's all because those waste products are building up in their blood. And since their fluid balance is all messed up, they might even get short of breath as fluid starts backing up into the lungs. But there is one major clinical clue that points right at the kidneys: oliguria. That's just a term for a significant drop in how much you're peeing. It makes sense, right? If the kidneys aren't filtering, they're not making much urine. This is one of the biggest red flags to watch for. Meanwhile, something else is happening silently inside the body: azotemia. This is the official term for that buildup of nitrogen waste products like urea and creatinine in the bloodstream. You can't see it or feel it, but it's a huge marker that doctors look for in lab tests.
But maybe the single most urgent danger of AKI is hyperkalemia, that's elevated potassium. You see, Healthy kidneys are what get rid of excess potassium. When they fail, potassium levels can climb dangerously high, so high that they can disrupt the heart's electrical rhythm. And that is a true life-threatening emergency.
Okay, so we've figured out the causes, we've spotted the red flags, so now what? What's the plan? Let's open up the management playbook and see how we respond.
Really, management is all about super careful monitoring and support. It means watching vital signs and lab results like a hawk. It means managing fluids with incredible precision, sometimes giving more fluids if the cause is dehydration, or restricting them if the body's overloaded. It is absolutely crucial to watch those electrolytes, especially potassium. And finally, in the most severe cases where the kidneys just can't bounce back, dialysis might be needed to step in and do the job for them.
So, let's wrap up with this thought. We've explored the three big mysteries of AKI: the flow problem, the filter problem, and the exit problem. So thinking about that, which type gives you the best shot at a quick recovery? Well, if you catch it early, it's often the pre-renal and post-renal types. And why is that? Because in both of those cases, the kidney itself, the factory, is still healthy. If you can restore the blood flow or get rid of the blockage, the factory can often get right back to work. It's the intrinsic type, where the factory's machinery is actually broken, that usually takes a lot longer to heal. All right, let's talk about chronic kidney disease. But we're not going to treat it like just another medical condition. We're going to look at it like a cascade of events, a series of dominoes falling one by one inside the body. It's a pretty incredible look at how our internal warning systems are supposed to work and, what happens when they start to fail.
So, that leads us to the big question, right? What actually happens when the body's master filters, your kidneys, start to give out? That's the mystery we're going to unravel today as we follow this chain reaction of symptoms and signals.
So here's our game plan. We'll kick things off with the silent decline of CKD, and then we'll learn how to decode the body's warning signs. After that, we'll get into the lifeline that is dialysis, and we'll wrap up by talking about a related issue, incontinence. Okay, let's get started with that very first domino. We're talking about the initial failure of the kidneys. And what's so tricky about this is that it often happens quietly, without any big, loud alarms going off inside the body.
So what exactly is chronic kidney disease, or CKD? Well, it's a progressive, and this is the most important word here, irreversible decline in kidney function. It's a slow, steady loss of ability, and it's usually pushed along by two of the most common health issues out there, diabetes and high blood pressure.
This really breaks down how that first domino falls. It all starts with progressive damage to the kidneys. As that happens, the glomerular filtration rate, the GFR, starts to drop. Now, just think of the GFR as a scorecard for how well your kidneys are filtering your blood. And when that score goes down, waste products start to pile up, which can lead to a really toxic state called uremia.
And here's where the next set of dominoes start to topple. See, that buildup of waste doesn't just stay in one place. It causes problems everywhere. You start seeing fluid and electrolyte imbalances. Precious protein begins leaking out into the urine. That's called proteinuria. It even messes with your hormones and can lead to bone disease. It's truly a full-body systemic problem.
Okay, on to section 2. As all these internal systems get more and more stressed, the body finally starts sending out some distress signals. We're going to look at these symptoms like critical clues. The body's warning system is finally making some noise.
So, our first classic sign is something you might not immediately link to your kidneys at all: pruritus. It's just the medical term for some seriously intense itching. But it's a huge diagnostic clue that something's off with the body's entire filtration system.
So why the itching? Well, it's because the kidneys just can't filter out waste products like phosphate anymore. As that phosphate builds up in the blood, it causes this relentless, awful itching. It's amazing, really. A symptom on the skin is telling you a story about what's going on deep inside the body. Now, the next major warning sign is anemia. This is when you just don't have enough healthy red blood cells to carry oxygen around your body, and it leads to this deep feeling of fatigue and weakness. And again, if you trace it back, the root cause is right there in the kidneys.
Here's how it works. Healthy kidneys make a hormone called erythropoietin, or EPO for short. EPO's job is to send a signal to your bone marrow telling it to make more red blood cells. But with CKD, the damaged kidneys can't make enough EPO. So no signal means no production, which leads directly to anemia. Simple as that.
Now, let's talk about probably the most life-threatening issue in CKD: hyperkalemia. This just means dangerously high levels of potassium in the blood. And it's called a silent danger because, honestly, the symptoms can be really subtle, right up until it becomes a full-blown emergency.
And I'm not kidding, the stakes here are as high as they get. This isn't some minor imbalance. High potassium directly messes with the heart's electrical system, and it can actually lead to cardiac arrest. This is a true medical emergency, which is why monitoring potassium is so critical.
So that brings us to Section 3. When that domino effect finally reaches end-stage renal disease, the point where the kidneys pretty much stop working, we need a lifeline. And that lifeline is dialysis. To put it simply, dialysis is basically an artificial kidney. It's a machine that does the job the kidneys can't do anymore. It cleans the blood, pulling out all those dangerous waste products like phosphate and potassium, and it gets rid of excess fluid. Okay, this next part is maybe the single most important slide here for anyone who might ever interact with a dialysis patient. A lot of patients have what's called an AV fistula surgically created in their arm. This is literally their lifeline, and the rule is simple. It's absolute. Do not touch.
And let's be crystal clear about what do not touch really means. It means you never, ever put a blood pressure cuff on that arm. You never start an IV in that arm, and you absolutely never, ever draw blood from that arm. Protecting that fistula is everything for that patient's survival.
All right, for our last section, we're going to shift gears just a little bit. I mean, we've talked a lot about the filtering of urine, but it's also really important to understand issues with controlling it. So let's dive into another key topic in urinary health, incontinence, or the loss of bladder control.
A really important idea here is something called neurogenic bladder. This can happen when nerve damage, sometimes from the very same conditions that cause kidney disease, like diabetes, messes up the communication between the brain and the bladder. And this can go one of two ways. It can cause an overactive bladder, which leads to that constant urgency and leakage, or it can cause an underactive bladder, which leads to urinary retention and a really high risk for infections.
Let's do a quick run-through of the main types here. First, you've got stress incontinence. That's when you leak a little from physical pressure, like a cough or a sneeze. Then there's urge incontinence, which is that sudden, intense, I have to go right now feeling. Overflow is what happens when the bladder doesn't empty all the way. And finally, functional incontinence is when some physical or even cognitive issue keeps a person from getting to the bathroom in time.
Now, the good news is there are a lot of really effective ways to manage this. It often starts with simple things like bladder training and just having a schedule for bathroom trips. Pelvic floor exercises can make a huge difference in strengthening those muscles. And even just lifestyle changes, like avoiding things that irritate the bladder, like caffeine and alcohol, can really help.
Phew! We have covered a lot of ground. So let's wrap this all up by focusing on the absolute key takeaways, the most critical, high-yield points you need to walk away with today.
Here are your memory shortcuts. If you ever see intense itching in someone with kidney problems, your brain should immediately think CKD. If a dialysis patient has a potassium issue, that is an emergency, period. The AV fistula arm is a total no-go zone for needles, cuffs, you name it. And finally, never forget, CKD is progressive and it is irreversible.
So I'll just leave you with this question to chew on. Now that you can connect the dots between something as seemingly simple as itching or feeling tired and this incredibly complex process of kidney failure, how does that change the way you see the body's warning signs? It's a pretty powerful reminder that inside our bodies, everything is connected.